Hi, good afternoon. My name is Anthony and I'm from the Respiratory Care Department. Can I ask for your complete name and date of birth? Thank you. I have to sanitize my hands. So, before anything else, I will just have to check for your vital signs. Would that be okay for you? Thank you. Can you lean forward for me, please, a little bit, and then do a deep breathing? Okay. Thank you. I just have to check for your other vital signs such as your heart rate and your level saturation. I also have to double check the ID band for confirmatory purposes. Okay, so I think I'm done taking up your heart rate for about a minute. So the reason why I'm here today is because the doctor ordered your breathing treatment. So there will be 3 different devices that I'm going to administer to you, and then these devices belongs to 3 different types. So it belongs under the anticholinergic, adrenergic, and corticosteroids. So for you to know is that both anticholinergic and adrenergic is indicated for your relief from airflow obstruction, and at the same time would have decreased the sputum production from your lungs. And then at the same time, the corticosteroids would help from any anti-inflammation that happened inside your lungs. So the first device is through a small volume nebulizer. The medication that I'm going to give to you is Furadil. This one is a long-acting agent which lasts for 12 hours and it is being administered twice a day. So as you can see here, I already have the medication inside. Sorry for the tubing, by the way. And then you position inside this mouthpiece inside your mouth. And then once you put inside your mouth, you should position your tongue below. Please do not obstruct the mouthpiece. And then once we're going to start, all you have to do is you just have to do normal breaths. Try to observe me. Just relax with occasional deep breaths. Okay, so are we ready to perform it now? Okay, so I'm going to use a compressor base inside your mouth. Okay, do normal breaths. Okay, very good. Continue with occasional deep breaths. Okay, so I think we're done taking up this medication. So before I will let you rest for a few seconds, can you deep breath and at the same time cough for me? Okay, thank you. So I'll just have to let you rest for about a minute in order for the drug to have an effect inside your lungs, while at the same time I'm preparing for the next dose. So I think I'm done letting you rest for about a minute. So the next breathing treatment is through an inhaler. So this inhaler is a dry powder inhaler, and then the medication that I'm going to give is Spiriva. It is a long-acting agent and it is usually being administered once daily when it will last for 24 hours. So this one is the inhaler. So this one is portable, and then before we proceed anything else, the preparation is you have to exhale all your air out away from the device until you feel your lungs are empty, like this. After that, try to check the device and twist it until you hear a click sound, which means it's ready to use. And then by the way, when you exhale all your air out, please don't exhale in front of the device. So that because it is a dry powder form of medication, if you exhale in front of the device, it might lead to clumping. And after that, position the device inside your mouth with your lips sealed. Then I'm going to count to 1, 2, 3. Okay, so I'm going to put this in your mouth. And then 1, 2, 3. Inhale. And then hold your breath. Hold your breath for about 10 seconds or as long as you can. Continue. And then remove the device and exhale normally. So can you breathe deeply again and cough for me? Okay, thank you. So I'll just have to let you rest again for about a minute. And then another thing to note is that I just have to inform you, by the way, that the medication that I administered to you first is having side effects like tremors or nervousness, and which is very normal. And then the other one is the Spiriva, there is having side effects of dry mouth. So I'll just have to let you rinse this, and then you don't have to swallow it. You just have to expel all those water out and spit all those water, so that it will prevent from having dry mouth. So I think I'm done letting you rest for 1 minute. So the last medication that I'm going to give you is through a different type of inhaler, which is a meter dose inhaler. And then this medication is what we call Aerospan, and it has being ordered for 2 puffs 2 times a day. So the difference of this one is that it is a liquid form of solution compared to the previous one, because that was a powder based. So first is you have to exhale all your air out away from the device, and then after that you position your hand, especially the index finger in the top, to help actuate or press the device, and your thumb below. And then shake the device, and then after shaking, actuate or press away from you. Okay, like that. And then position this one inside your mouth by having the lips sealed, and then your tongue should be below. Please do not obstruct the mouth, please. Okay, so I think we're ready to go already. So I'm going to put inside your mouth. Then I'm going to count 1, 2, 3, and inhale deep. Hold your breath. Hold your breath. Hold your breath. And remove the device away from you and exhale. Okay. So I'll just have to let you rinse your mouth, by the way, because this medication is a corticosteroid. So the side effects of this one is it would lead to change of your voice quality or having oral thrush. So here is a glass of water. Please rinse your mouth, gargle it, and spit all those water out. And then can you inhale deep again and cough for me at the same time? Okay, thank you. So I just have to reassess again and check for your vital signs. Lean a little bit forward again. Okay. Very good. Check your heart rate. I think I'm done taking up your heart rate and other vital signs. So another to note for you is that because, for the storage of the device, the inhaler should be stored upright, especially the meter dose inhaler, and it should be stored in a room temperature. And then, by the way, for the meter dose inhaler, try to double check the dose counter, so that for you to know how many doses remaining from that device. And also double check the cap for any foreign objects that obstruct. And also about the small volume nebulizer, please remove each items from the device, and then set aside the tubing, and then those devices that you remove, please rinse them with sterile water. Please do not rinse it with tap water, so because it might lead to contamination. After that, you put it on the side in a clean paper towel, and then allow it to air dry. So if there anything else that I can do for you, or any further questions so far? Okay. So if the symptoms will persist more than once, please don't hesitate to inform your physician or even us, so that we can alter or change the dosage and its frequency. Thank you so much, and have a good day.